With season's greetings, I am Dr. Subrata Pal, Senior Consultant Gastroenterologist and Liver Specialist. Today we are going to talk a common problem of common people, that is fatty liver disease. As we know, the fatty liver is two types. One is alcoholic fatty liver, one is non-alcoholic fatty liver. So alcoholic fatty liver is those foods where the patients are usually used to take large amount of alcohol for a long period of time. But in absence of alcohol intake, if there is accumulation of fat inside the liver, then we can call it as non-alcoholic fatty liver disease. Normally there is some amount of fat present inside the liver, but if the liver fat is more than 5% of its liver weight, then we can call it as a non-alcoholic fatty liver disease. Now fatty liver, what bothers us about the fatty liver? Because fatty liver, when there is accumulation of fat, the liver function may be jeopardized or may be decreased, and the liver may be stiff, hardened, with progression of liver disease, with fibrosis and cirrhosis with very long period of time. So not all patients of fatty liver do not develop liver fibrosis or liver cirrhosis. It depends upon the genetic background of the patients. But apart from accumulation of fat, if there is other comorbid conditions are present in the subject, that is diabetes, hypothyroidism, hypertension, dyslipidemia, all these factors come into play for fatty liver and its consequences. So who are the patients suffering from fatty liver disease? Because most of the time patients do not produce any symptoms or any signs of fatty liver, but due to the use of other investigations like ultrasonography or blood parameters like liver function test, there is some evidence of transaminitis or evidence of fat accumulation inside the liver. In those group of patients, they came to us for management of fatty liver with incidental diagnosis. So, patients who are the patients who suffer from fatty liver, like obesity, hypertension, diabetes, dyslipidemia, metabolic syndromes, family history of liver cirrhosis, and family history of coronary artery disease. These are the group of patients who are usually having associated fatty liver, because it is a common problem of most of the patients with this group of patients. So how to diagnose fatty liver? Fatty liver can be diagnosed by blood test, can be diagnosed by ultrasonography, and also other tests like elastography of the liver or fibroscan of the liver, and ultimately by doing liver biopsy. But liver biopsy is not possible in all patients. So fibroscan or elastography of the liver can be done to diagnose the stiffness of the liver and the progression of fatty liver. And how to manage this fatty liver? There is no such specific molecules or specific medicines available for management of fatty liver, but it should be a holistic approach, because lot of comorbid conditions, lot of cofactors are there for fatty liver, like diabetes, hypertension, dyslipidemia, hypothyroidism. All these factors come into play. So we have to manage holistically with multidisciplinary approach. Apart from medicines, some dietary restrictions, exercise, weight reductions, and lifestyle modifications, and avoidance of addictions like smoking and other tobacco products is very much helpful for management of fatty liver. For weight reduction, it is recommended that at least 10% of the body weight has to be reduced over a period of 6 months' time, but it is very difficult to achieve the goal. But about 5 to 7% reduction of body weight can be very much helpful for management of other comorbid conditions, and also to reduce the liver fat. And for regarding diets, hypocaloric diet has to be advised. Hypocaloric diet means less amount of carbohydrate and less amount of saturated fats, and raw sugars has to be avoided, and lots of fresh fruits, vegetables, fibers, along with other multivitamins and multiminerals and nutrients has to be incorporated in the diet chart. There is one specific diet is very much helpful, that is Mediterranean diet, which can be advised for patients with fatty liver, with obesity and metabolic syndrome. For management of fatty liver, most important is the lifestyle modification, exercise, walking, and dietary modification. These are the factors, along with the management of the other cofactors present associated with fatty liver. So, in nutshell, this is fatty liver. By this talk, I want to convey to the message that fatty liver can be diagnosed by doing ultrasonography, by doing liver biochemistry, and also assess the degree of severity of the fatty liver by doing fibroelastography. And according to the stage of the disease, we can modify our management protocol. But most important aspect is the dietary modification, weight reduction, exercise, and management of the other comorbid conditions.